Again, this is Kim Beer. I'm the Director of Public Policy at the Reeve Foundation. We're thrilled that you've joined us today. We're just about at 12 noon Eastern, so good morning and good afternoon, wherever you may be. And we're so grateful that you took the time to join us. This webinar is our post-election update and some election results and their implications. And before we get started, I want to talk a little bit about some housekeeping. We will, of course, be recording this webinar, and we'll do our best to monitor questions throughout the webinar. So please feel free to submit a question through the chat or raise your hand, and we'll try to answer them in real time. And if we can't, we'll be sure to get them. We'll have plenty of time at the end for questions. And also during the webinar, we'll do our best to insert links in the chat wherever we reference a link. We will send the recording and the slides, as well as any links that we reference during this webinar, so that you have all the information. And of course, Chris will be happy to answer any questions you may have or provide you with any additional information. So on today's webinar, well, again, we'll talk about the election of 2020 and its implications. We'll tell you all the results that we have to date. We'll talk a little bit about the transition for President-elect Biden and what we suspect will be the new administration's priorities. Of course, Congress still has some work to do to post-election, so we'll talk a little bit about what we think might happen in the lame duck session. And I know many of you are tracking the news and doing your best to stay safe and follow the CDC's recommendations. But we will talk a bit about COVID response, especially as we've seen around the country numbers really increasing. And finally, we'll address some of the activities of the Supreme Court around the ACA. And the second part of the webinar, we'll talk more about our Regional Champions program. We're so grateful for all of the regional champions who have worked so hard this year. We want to continue to grow our program, so we really encourage you to help us recruit new members of our program. We'll talk about some of the Reeve Foundation's upcoming events and, of course, take questions. I'd like to talk about our panel. We're thrilled, of course, to have our returning veterans, John and Chris, but we're thrilled to have Celicia Lomax, who's the new associate at Waxman Strategies, and she's going to kick off our presentation today. Celicia?
Yes, good morning and good afternoon. Thank you to everyone that was able to join us and to those that will hopefully be watching this recording later. Again, I'm Celicia and I'll be walking you guys through some of our election results. And so just to start off, this election was really unlike any other election that we've seen, mostly due to the unprecedented number of mail-in and absentee ballots that came in this year, which led to a delay in receiving a lot of the election results that we're actually still getting. What we do know is that we do have a new president-elect with Joe Biden, and he was able to secure some key wins in states like Wisconsin and Michigan, which helped to propel him to that presidency, along with some suburban shifts towards Democrats that helped him as well. In addition to this, there were a number of important demographic voter shifts that we should take note of. One of the first that came shocking news to both Democrats and Republicans is that Democrats struggled to secure Latino votes this year, especially in states like Florida and Texas. And this is particularly important because for the first time in our election history, Latinos became the second largest voting demographic after white people in the country. And so it's important to take note of their vote. In addition to this, 55% of white women voted for Trump in 2020, which is an increase from the 52% that we saw in 2016. And lastly, Black voters in major cities such as Philadelphia, Detroit, and Milwaukee helped to secure the Biden election this year. And so moving on to the Senate results, this is actually still ongoing, but what we see so far is that we have more of a Republican majority in the Senate, in which they're holding 50 of the seats right now, whereas Democrats have 48 seats in the Senate. However, there are 2 Senate seats that have yet to be called. Both of those seats are in Georgia, and so they have a January 5th runoff election. And so all eyes are currently on Georgia to sort of look at who may hold the majority. If those two seats are taken by Democrats, then that would mean that they would hold the majority with the Vice President-elect Kamala Harris as that tie-breaking vote. And so moving on to the House results. This, on the other hand, from this Republican majority in the Senate, it looks like we'll have a House majority or Democrat majority in the House. They have the 218 seats to hold that majority, and Republicans have 203. However, there are still 14 races that have yet to be called. And so we'll see what the House looks like in the coming weeks. But this is likely to be the narrowest House majority in 18 years. So this is something that will be important to note as we see a little bit more influence possibly from Republicans within the House and some additional challenges for Democrats as they move forward. And so I'm going to pass this over to John now to sort of talk about the timeline that we should expect from this post-election period and some of the implications from the results.
Thank you so much, Celicia, and thank you, Kim and Chris, and to the Reeve Foundation and everybody who has joined today. Celicia, I think that was a really, really clear breakdown of what we've seen over the last week. Who needs Steve Kornacki or John King when we have you? But I think, you know, as you started by saying, this really is an election that's been unlike any that we've had, mostly because of the way that the results did not all come in on election night, but rather, you know, over the course of a number of days. And I think that's contributed to some of the ongoing discussion and confusion and sort of the challenges that folks are facing sort of moving ahead with the transition. So let's talk about that a little bit and what some of the key dates are between now and Inauguration Day. First of all, states all need to certify their results. So when elections happen, the media has their own decision desks. They do statistical analyses and look at all the numbers, and that's how they make their calls, but it's not official until states certify their deadlines. And all states have a deadline by which they have to certify those. And I think all or the vast majority of the key states, those deadlines are in November. If there are any state disputes, there's a deadline of December 8th to resolve those state disputes. And then, of course, as folks are familiar, what we have in our country is not actually a direct election of the president, but an election of the electors who then meet in the Electoral College and vote for president. And so that Electoral College meeting is on December 14th. That's one more step in making it official. The House and the Senate then certify the election and announce the winner in early January. One date that's on here, that's not on here, and it's because it's not a presidential transition date, is that the new Congress, the new House and the new Senate take office on January 3rd. So it will be the new House and the new Senate that hold that joint session. And then Inauguration Day, as folks know, it's actually laid out in the Constitution, is January 20th. And the power of government is officially handed over at noon on January 20th, both in the White House and across federal agencies. So let's talk about sort of who we're paying attention to as we look at a transition to a new administration. One story that folks may have seen is that in order to really officially kick off the statutory and the federal transition, the results of the election have to be quote unquote ascertained by the head of the General Services Administration. The GSA is a little known federal agency, but it's sort of the landlord of the federal government. They control all the buildings, all the resources, those kinds of things, federal office space, computers, and they are in charge of the budget, the official budget for the transition. This has not happened yet, and that's a controversial thing. The appointee, Emily Murphy, who leads the GSA, has not yet finally certified that. There are transition activities, however, underway within the Biden operation, in part because they've raised a significant amount of private funding to support the transition efforts that will then be supplemented with federal funding when the GSA makes its ascertainment. One of the things that we've seen, really the first step of the transition, is that President-elect Biden and Vice President-elect Harris announced their COVID-19 advisory board task force. It's made up entirely of health experts, scientists, doctors, including several names that are potentially familiar to folks. Dr. David Kessler was FDA commissioner during the Clinton administration. Dr. Vivek Murthy was Surgeon General during the Obama administration. And the third co-chair is Dr. Marcela Nunez-Smith, who's a physician and researcher at Yale. And so that group is meeting and really figuring out what steps need to be taken to translate the Biden COVID plan, which we'll talk about in a few minutes, into new administration policy. The broader work of the transition, which is well underway and actually has been underway for months by law, is to figure out policy and, importantly, figure out personnel for the new administration. So there are over 4,000 what are called political appointees. They're called political appointees because they're made by each administration, as opposed to most federal government staff who are career civil service. And of those, about 1,200 or so require Senate confirmation. So that, that includes everything from the leadership of HHS, FDA, CMS with Medicare and Medicaid, ACL, which of course oversees a lot of the programs that we follow, including the Paralysis Resource Center. It also includes the White House top staff. And one thing we learned last night, once these slides had gone to print, was that as expected, President-elect Biden has named Ron Klain to be his White House chief of staff. He's a longtime Biden staffer, was chief of staff to then Vice President Biden, and was named by President Obama to be the sort of top official in charge of Ebola response during the Obama administration. So he has both government experience and infectious disease experience, which will come in handy. The White House staff is likely to be made official, starting with Ron Klain, but they'll talk about other positions before they start talking about agency leadership and cabinet members. But we are expecting to hear names of different cabinet appointees, included as soon as before Thanksgiving. So even as all of that is happening on the administration side, and there is an enormous amount of work that goes into a presidential transition, Congress still has to meet to finish up its own business. Congress set before, as we've talked about in past webinars, before the election, before they recessed for the election, they set a deadline of current funding for the federal government through a continuing resolution of December 11th. So Congress has to come back to town and figure out a path forward, at the very least, just for annual appropriations for regular government funding. And there are really three possible paths they could go there. The first is what's known as an omnibus bill that would actually go through program by program and set new funding levels for the current fiscal year. As a reminder, that fiscal year already started October 1st. But this would be sort of the most preferable outcome, because they would actually be able to determine program levels for each program. They could potentially pass another short-term continuing resolution, which is essentially, think of it as putting the funding of the government on autopilot and just extending everything at current levels. That could go till another week. It could go another 2 weeks, although that would take it right till Christmas Day. It could potentially go as far as into the early part of next year. And then there's the possibility, although probably unlikely, hopefully, of what's called a year-long CR, or a long-term continuing resolution, where Congress would basically say, we're just going to set the program levels for every program in the government at exactly the same levels that they were at last year. And what that problem with that is, it really doesn't allow for Congress to take stock of different events. And it's not just in domestic policy, but defense really suffers under a year-long continuing resolution. The other big thing that's on Congress's plate, and it has been for months, is looking at another COVID-19 relief package. And unfortunately, I think it's fair to say they're still quite far apart over the size and scope of any package along these lines. Senator McConnell, majority leader in the Senate, is expected to take a bigger role in relief talks. Those talks to date have been mostly between Speaker Nancy Pelosi and House Democrats and the White House, mostly in the form of Secretary of the Treasury, Steve Mnuchin. And so the Senate will be more involved in these talks going forward, as will the Biden transition team. And so you'll have more players at the table. The hope is that either something can happen before the end of the year or soon after Inauguration Day. And again, that without an election looming right, days away, that they'll be able to set politics aside to some degree and come up with something because there's so much need. Excuse me. Just had to sneeze there a little bit. So George, as Celicia mentioned, the Georgia Senate races will really play into this because control of the Senate is determined by these Georgia races. So it will be interesting to see, and we don't have a clear view of this yet, whether they will try and take on COVID relief before or after the Georgia races. So let's talk a little bit about some of the stated priorities of the new administration that's coming in. President-elect Biden has talked really about addressing 4 different crises, as he's put them, in American life right now. And that begins with the pandemic, then the economic recovery that is so crucial to, and tied to the results of the pandemic. Really amplifying, I think, and elevating a focus on racial equity. And he talked in his inauguration speech about, rooting out systemic racism in our culture and in our country. And then lastly, the ongoing crisis of climate change. And so there are some really, really large, really structural issues that the transition and the new administration has identified as their top priorities. They've also spoken directly to really enhancing the role of people with disabilities, both in the policy development process. And I think you heard in the election night, or I guess it wasn't election night, but the speech the night the election results were called, President-elect Biden specifically talk about people with disabilities as one of the constituencies he's grateful to for support and that he's going to be focused on going forward. And also their policy platforms talk significantly about enforcing civil rights for people with disabilities, enforcing accessibility. And you'll hear from us as the year goes on about some of our agenda and the foundation's agenda when it comes to those issues. So as we said, under a divided Congress, it's going to be pretty difficult to have an enormous stimulus package, COVID response package, the size and scope of which we saw in the early days of the pandemic. And yet, the numbers, as folks have seen, are really starting to spike, as was predicted with the onset of colder weather. And so we're at well over 100,000 cases a day. I think it's up to around 140,000. Well, back over 1,000 deaths a day. And so, in certain states, you're seeing hospital capacity really at its limit or starting to be over its limit. And so some of the things listed here, I don't have to go through all of them, but these are really the items that are on the list for President-elect Biden and for the the congressional response that they're hoping to see in COVID. As I said, President-elect Biden has named the experts to his COVID-19 task force, including one former Trump administration official named Rick Bright, who was the head of the vaccine department, essentially, within the FDA. Rick Bright resigned in protest earlier this year after feeling like some of the vaccine and scientific developments were being made with too much political influence. So he'll be a part of that group. And as you can see here, it's not just focused on vaccines, but it's going to be talking about testing, about distribution, about personal protective equipment, et cetera. The President-elect has called for some other additional measures to be taken using the Defense Production Act, which has been used somewhat, but allows the federal government to essentially commandeer industries and direct them in certain ways and guarantee purchase of products from the federal government, to ramp up PPE production for frontline workers, to increase testing, and to increase contact tracing capacity. There's also an effort that they've outlined to work with the CDC and governors to make consistent messaging. They've talked about how social distancing and the response that we need to have to COVID in a community is not an on-off switch, it's more of a dial. And they want to be clear, and they want the CDC and the state governments to be more clear when it comes to where that dial needs to be set, depending on what the circumstances are on the ground. And then again, urging governors to adopt statewide mask mandates. We're starting to see this as cases get worse, including in red states, blue states across the board. Utah and Ohio have both started ramping up their mask mandates, and to provide clear public health guidance about social distancing, limiting large gatherings. You're starting to see that happen at the state level, but I think as the administration takes shape and as the task force recommendations come together, you're likely to see that happening at the federal level as well. So for better or for worse, COVID is not the only health policy issue, the only crucial issue that is front burner for both the new Congress and the new administration. As folks who've been on our webinars know, the Affordable Care Act continues to be challenged in the courts, if not really challenged effectively in the legislature. So as folks maybe saw earlier this week, the Affordable Care Act case, Texas versus California, was argued before the Supreme Court. The clear takeaway from those oral arguments is that it is very likely that the ACA will survive this court challenge. You heard Chief Justice Roberts and Justice Kavanaugh being very, very clear in their questioning and in their comments during oral arguments that it is not the court's role to invalidate the entire ACA, even if one part of the ACA, in this case, the individual mandate requiring people to purchase insurance, even if that one part has been deemed unconstitutional. So what we do think will happen is some form of a debate in the coming year, maybe 2 years, over what to do about expanding coverage. It's unlikely that we're going to see ACA repeal from the courts, but if we did, the public option continues to be an option that the Biden administration, incoming Biden administration, has championed. I think it's fair to say that the folks on the left who've been proposing Medicare for all or a single payer system, that has not taken hold amongst the Biden folks, and he didn't run on that issue. And so what he will likely be focused on in terms of coverage is expanding on the ACA. And there's a lot that they can do just with control of the federal agencies, and then even more that they can do if they're able to pass something through Congress. Some of the other issues that we're paying attention to and that we know will be very high on the priority list, looking again and ongoing at racial, economic, and other health disparities, expanding eligibility for Medicare and Medicaid. The Biden administration is very keen to try and push an agenda that incentivizes states to expand Medicaid that have not yet done so under the ACA Medicaid expansion. They're also going to be looking very closely at the cost of prescription drugs. There's comprehensive legislation that's already passed in the House that would allow for Medicare, among other provisions, would allow Medicare to negotiate the price of prescription drugs for Medicare beneficiaries. They're still working on legislation around surprise billing. And of course, over top of everything in American health policy, especially, is the debate over access to abortion and Roe versus Wade. And so that may, challenges to Roe may continue to make their way into the court system. And there's speculation that with an enhanced majority on the Supreme Court, conservative majority, we could see a more aggressive challenges to Roe versus Wade. So that's a lot to have covered. And hopefully we'll get to some questions at the end. But in the meantime, we really wanted to spend the rest of our time talking about how can you make your voice heard? How can you be participating in all of this activity that's going on? I will say, you can feel a change in Washington, not just, not a partisan statement, but just from the fact that you have a whole new group of people coming in, you have new members of Congress coming in. The beginning of these every 2-year cycles, and especially every 4-year cycles, there's just a lot of activity and there's a lot of opportunities to really weigh in and to make a difference. So with that, I'm going to turn it over to Chris, and he's going to talk about some of those opportunities.
John, this is Kim. Before Chris gets started, I wanted to just emphasize a few things that, it's been about 9 days since the election, and we've all been glued to our TVs. I wanted to just reemphasize a couple of really important points here, and to also emphasize, something that I think we should have spent a little more time on. The first thing is, the historic voter turnout is really, really extraordinary. And we spent a lot of time educating our community around the importance of exercising their vote and their right to vote safely. And of course, every state had different ways of doing that. So I want to thank those that exercise their right, and we'd love to hear from you about your experience. But I think the numbers are really quite extraordinary. From what I understand, there's about 240 million Americans who are eligible to vote, and nearly 150 million individuals exercise their right. So I know we mentioned that, but I really want to emphasize that and thank all of you if you did in fact either venture out on election day or submitted your ballots in a different way. That's one point that I think is really extraordinary. I think since we've been analyzing so much information and we were waiting for states and their return, I don't think we really properly acknowledged the extraordinary accomplishment of Senator Kamala Harris and her achievement in being the first woman vice president of the United States. Of course, she will be sworn in January. She's the first Black and South Asian woman to represent us in the executive branch. And so I really wanted to also acknowledge that too as a really extraordinary achievement. And we're thrilled to be working with a new administration as well. So especially around disability issues. So I wanted to acknowledge that again. And John mentioned, some aspects of the transition team and the Reeve Foundation. We're starting to draft a letter to the transition team around some of the priorities, introducing the work of the Paralysis Resource Center and the work of the Reeve Foundation. So I wanted to let everyone know that we're working on that, and we'll be sending it to the transition team on behalf of the foundation and the community and the important issues that we really would like the new administration and HHS to take on, and how we want to be partners with them as well. And we hope we can get you involved in that. And the final is really a question for John. And John, you just briefly talked about it, but could you just remind everybody where we are with Paralysis Resource Center funding? What do you think might happen? The regional champions have worked really hard in ensuring that we maintain our funding. So would you just talk about that for a second before we get to Chris?
Absolutely. Yeah. Thank you for that question, Kim, and thank you for those other statements. So in terms of Paralysis Resource Center funding for next year, we're in really good shape. And the reason for that, in addition to the main reason for that, is your advocacy and the amazing work of the PRC staff in just running a really good program, and the Reeve Foundation and overseeing federal funds so effectively. In terms of Congress, the reason for feeling confident about where we sit is that both the president's budget request, which is sort of what starts the federal budget process for the year, as well as now the House passed appropriations legislation for this year. And this week, the Senate released their version of the appropriations legislation for this year. All three of those call for the same number, for the PRC, which is $9.7 million for the Paralysis Resource Center program. And, that's a real achievement. That's an increase that was sustained from last year. It's a new thing this year for the president's budget to have called for full funding for the program, and that number is equivalent to what we and the foundation requested from Congress this year. So even if Congress goes into a continuing resolution, and even if they go into a year-long continuing resolution, because we're asking for the same amount of money as last year, that $9.7 million, we feel very confident that that's the amount that the program will end up with, regardless of sort of how the congressional process finalizes. Is that helpful, Kim?
Yes, thank you very much.
You bet. Chris, you want to take it away?
Yeah, thank you, John, and thank you, Kim. Thank both of you for summing things up and putting, the state of things in perspective for all of us. I think, as John mentioned, you can really feel things down here in DC, that things are moving. People are preparing for a change of Congress, a change of administration, and that seems like a really great time for us to sort of renew our focus on the Regional Champions program and think about how we can start expanding some of our reach up here on Capitol Hill. To put it simply, more regional champions spreading out our grassroots into different congressional districts help us, get in front of more members and really amplify our message to Congress. And right now, here's how the Regional Champions program shakes out. We have 43 regional champions, dedicated regional champions, representing 21 states and representing 38 congressional districts. Our long-term goal is to cover the map. We want regional champions in all 441 districts. That's 435 in the states and 6 territories. So we have a long way to go. But again, as things start to shift, let's take some inventory as to where we are and where we might want to go with this program to ensure that we can keep doing this great work on behalf of the paralysis community. So moving on to the next slide, we can look at, well, where do we start? That's a lot of ground to make up as far as our reach in Congress, but we can start by taking the first small step towards reaching that long-term goal by just asking yourself a few questions that I would love to hear the answers to. So after ponder these questions a bit after this webinar, think about the answers, and then please reach out to me through email or phone and let me know what you think. First things first is starting at home. Who can you think of who you've met in your own advocacy work, maybe on separate issues from the Reeve Foundation, or other work that you've done for the paralysis community? Who can you think of that might be interested in joining the program? And I'm going to drop a link here in the chat, which is to sign up to be an advocate, which all of you have, and you've been so consistent in taking action, sending letters to members of Congress. This is a great way for people that are curious about the program to get involved, see the types of things that we're advocating for, and to start right away in making their voice heard to their elected members. Also, I'm going to ask you to think creatively about what we can do here at the Reeve Foundation, myself and Kim. How can we help give you the tools that you need to extend that hand out to other advocates or passionate people in the community that might want to get involved? Maybe you have a large social media following and you have some ideas on how we can use some of our events to promote across channels and let people know about the opportunities that come with being a regional champion. Maybe you're a writer, you have an idea for a blog post. We'd love to hear what you're thinking about and what you want to talk to the community about. I can say that we're also working right now. I'm working with one of our regional champions, and I'm not sure if she's with us, but working with Deborah Vick on trying to set up more regularly occurring kind of social event space for our regional champions, which when we get that up and running, I hope that all of you come along, and I hope that you invite, a friend or family member or an ally that you have in the community to come and join us and to meet some other advocates and to see what we're all about. And then just some more food for thought, let me know what your favorite part or what you think is the best benefit about being a regional champion is. What's the appeal of the program to you? And then how do you think, we can be improving the program or making it more inviting to people, or just helping you stay up to date and armored with the information that you need to advocate for the work that we do. So moving on to the next slide, a couple of opportunities that are coming up in the near future to get involved in some things. We have on November 18th, the Raise Family Caregivers Council, which I will get into in a little bit more detail on the next slide. They're going to be having their 6th public meeting. It runs from 12:30 to 4:30, but as I'll explain more in the next slide, they're looking for public input. So that's a great place for you to show up and to have your voice heard. On November 25th, and before I do that, let me drop the link in for the Raise Family Caregiving Council's meeting. You can register here at this link I'm putting in the chat. And we'll also, as we mentioned, we'll include that at the end in our email to all the attendees. And one more link for the Reeve Foundation events, where on November 25th, we'll be hosting Nurse Linda. And on December 1st, we will be hosting another seminar, Living Well with Dr. John, where Dr. John will go over issues surrounding sexuality and living a more fulfilling life in that regard. And of course, January, we'll get deeper into our priorities for 2021 in our next January Regional Champions webinar. So be on the lookout in your inboxes for more information about registering for that event. So moving on to the next slide, our Raise Family Caregivers meeting, which we are really excited about because another one of our regional champions, James Murtha, is actually on the Caregivers Council and has been working with them for as long as I've been with the Reeve Foundation. And Raise Family Caregivers Act was an act of Congress which on law, January 22nd, 2018, directed the Secretary of Health and Human Services to develop a national family caregiving strategy. And as John mentioned, some of the new priorities that are going to be moving in with the new administration. We know that the Biden transition is already talking about a plan for caregivers. So there's a real opportunity that the proposal, which we're expecting to get from the Caregivers Council, could end up having some real impact on the development of a national caregiving strategy. It'll be their 6th meeting. Again, it's November 18th from 12:30 to 4:30 p.m. It's open to the public. And if we move on to the next slide, where we have the same quote repeating, but we'll see there's our regional champion, James Murtha. And James says, "We need your participation and your voice to help us create ideas that accurately and effectively make far-reaching impacts considering diverse backgrounds and circumstances." And I don't know if James is in the meeting with us now, but maybe if he is, you can drop in the chat what body of water that is. But in the meantime, just keep that in mind, that this is really an opportunity for us to grow, to get some more diverse voices, not only to the Raise Caregivers Council, but also here at the Reeve Foundation and the Regional Champions Program. So take a look at those questions one more time, and please, I look forward to seeing all of your responses in my inbox and keeping this conversation up and really building this program out to have its greatest impact. Thank you all.
Thank you so much, Chris. And of course, I can't help myself. I wanted to add a few things to your presentation, and thank you for all your work. Chris is still relatively new to the foundation and has done a lot. And Chris and I are going to spend the better part of the rest of the year and early next year to really improve some of our materials and create more trainings for all of you. So we want to make sure that this is engaging as possible. But I want to just acknowledge, because sometimes our colleagues at the Administration for Community Living sometimes watch our presentations, and I want to say it's been a real pleasure. Many of them will stay on as staff within the Department of Health and Human Services at ACL, and some others may go because of the new administration coming in. I really want to acknowledge all their support and help and these past few years. So, ACL has been very supportive of our work, and I really want to acknowledge that. And I also want to reiterate, John says this all the time, our work is very bipartisan. We have an awesome opportunity at the beginning of the new year to develop relationships with every Democrat, new and old, every new Republican and old Republican and independent. So that's why we really want to grow our program as well. This is not just one party. So our issues span across the aisle, and we'll continue to work across the aisle as well. So I'm not sure if there's any questions. We went over a lot of information.
Give people maybe just a minute, but in the meantime, my guess, Chris, is that knowing James, that's one of the Great Lakes bordering the state of Michigan. Of course, there's 4 of the 5 Great Lakes border Michigan, so it's hard to say which one, but if we know him,
I thought exactly.
he's a Michigan guy, so I'm guessing it's one of those.
And we really want to be able to highlight new regional champions too in our webinars. So Chris and I will be working on that as well. Okay, I don't see that there's any questions. Kaylee, are there any questions that we're missing? Do you see by any chance?
No, I think that's it. I don't see any in the chat or the Q&A.
Great. Chris, I don't know if you have any final words, if you want to end the webinar.
No, I just appreciated that reminder, Kim, that, we work well with both sides, and, definitely looking forward to having all the viewpoints represented with the Regional Champions program, because the diversity of backgrounds and regions and congressional districts is really what gives us our strength. So I appreciate that reminder.
Thanks, everybody.
Thank you. Take care.
Oh, it actually looks like we do have a question in here.
Oh, all right.
Someone just asked in the chat, how do we sign up for Raise?
To be on the council, I'm not sure if that's an option, but I know to sign up to join the webinar, we've dropped the link in our chat there, and we can also send you a email with the sign up. So I'm glad that, Colleen, I see your questions here on the chat. We appreciate that you're here and that you're new to all of this. I would say our Regional Champions program is our grassroots advocacy program here at the Reeve Foundation. What we call our legislative first responders is a passionate group of individuals and advocates who sign up to volunteer their time to talk to the members of Congress about the issues that we're advocating for at the Reeve Foundation, and to learn more about advocacy principles and organizing strategies, and just taking that step to get deeper involved in the political process. We really appreciate you being here. And my email was on the webinar, but I can also drop it in the chat here. Please feel free to reach out to me for more questions there at ccarson@christopherreeve.org. I'd love to talk to you about it offline here.
I think Colleen is asking about the Raise Council, and Chris, we can make sure she gets the information. But it looks like you sign in and they post the link to get into the Zoom meeting the day of, or 15 minutes before the meeting starts. So it is a little confusing because I thought I could register myself, but we'll be sure that you get the link. And I think that those are the directions. They don't actually have a registration form, and it's online.
All right.
Yeah, Felicia makes a good point, Chris, and I think you've shared the links that you shared most just with the panelists. So I think we saw those, but maybe not all the attendees did. So maybe before we close, you can share them with all attendees. And then
Yeah,
I
here,
know
I'll drop.
that is they'll be in the follow-up email along with the recording of the webinar itself. So if folks don't get to see the links in the chat, just know they'll be coming to your email as well.
That's right. Thank you, John.
And thanks, Felicia, for pointing that out.
Yeah, we certainly don't want to just be talking to ourselves. Thank you, everybody.
Do
For
enough
all
of
your
that.
Stay safe, everybody, and happy holidays. Enjoy whatever time you can spend with your family.